Welcome to the press conference of the Joint Prevention and Control Mechanism of the State Council. Our efforts are at its critical moment. Medical supplies are concerned by the entire Chinese people. At the guidance of the State Council, the Joint Prevention and Control Mechanism have stepped up our efforts in allocating resources to where most needed. Today, we will focus on the assurance of medical supplies and the allocation of resources. We have Director General Level Inspector Mr. Xia Nong from NDRC, Director General Madam Cao Xuejun from MOII, Madam Guo Yanhong, Medical Administration and Hospital Management Department of National Health Commission. We also have Senior Consultant Researcher Mr. Zhang Liubo from CDC to give us some scientific know-how. Guangdong Medical University has been collaborating with the Guangdong Customs and have isolated virus from the feces of patients. I want to make some clarification. In the early symptom, there are diarrhea and other symptoms, and in the sampling of the feces of the patient, once there is positive testing results, the virus can be amplified in the GI tracts. No matter it is early onset or a combination of symptom, fever, fatigue, dry coughs are still the most important clinical symptoms. The isolation of virus from the feces samples does not mean the major transmission pathway has changed. Respiratory tract transmission is still the main source. The fecal-oral transmission still needs further study to be confirmed. Good hand hygiene is still one of the most important ways for prevention control. Frequent hand washing, standardized hand washing, the use of hand sanitizers can reduce the risk of infection. In epidemic heat areas, restaurants, hospitals, and shopping malls need to step up regular disinfection and sanitation. Now we will directly take questions from the floor. Please identify yourself. Now the floor is open. And the second row. Thank you. I'm from Xinhua News Agency. We've learned that there has been surge in the confirmed cases in Hubei province, and the province is under tight medical supply. My question goes to DG Cao of Ministry of Information and Industry. I'd like to ask Madam Cao to take the question. Under the guidance of the State Council and the Central Party Committee, the Joint Prevention and Control Mechanism, in light of the needs of Hubei Province and the city of Wuhan, medical garments, masks, and negative pressure ambulances and other key medical supplies have been allocated in a holistic way. MOII has been one of the department steering the entire efforts. We've been promoting the recovery and the resumption of the manufacturing to manufacture more medical supplies, and we have made holistic arrangements for the allocation of such medical resources by the 12th of February. Domestic manufacturers have delivered 726,000 protective suits, 340,000 goggles, over 2,000 respiratory machines, heart monitors 6,900 plus, infrared monitoring, temperature monitoring machines over 70,000. In the next step, we will continue to support Hubei Province and Wuhan City with more medical supplies. Next question, please. Journalist on the second row from the left side. Thank you. I'm from Economic Daily. We've noticed that as cities have resumed their operations, the manufacturing capacity of masks have been improved. What are the measures adopted by NDRC to expand the manufacturing capacity? Will there be follow-up measures to further enhance the capacity of manufacturing? I'd like to ask DG Inspector Xia Nong from NDRC to answer the question. Thank you for the question. Face masks is very much concerned by the general public. The day before yesterday at the State Council press conference, NDRC colleagues have shared information on the production capacity improvement, the importation expansion, and the scientific use. Now, I'd like to focus my comment on the expansion of manufacturing capacities. In the past few days, we've carried out the following efforts. We organized enterprises to restart business. We've implemented the State Council's guidance on organizing the recovery of work by major manufacturers to ensure medical supplies. On the 1st of February, NDRC collaborated with the Ministry of Industry and Information Technology and issued an order to localities to organize manufacturers to expand capacity. At the same time, they need to ensure the safety running of enterprises. Now they are operating in full capacity. Second, we've been promoting the upgrading and the transformation of the business. NDRC collaborated with the MOII and organized a number of medical supply manufacturers to transform and upgrade their manufacturing capacities. Given the tight supply of face masks and other medical supplies, NDRC urgently started a dedicated program on expanding the capacity of face mask manufacturing. Third, we tried to ensure the whole production chain synergy. We've adopted unconventional measures at this unconventional time. The manufacturers, particularly those in key areas, have been mobilizing the funding resources allocated to them, and they have improved their capacity to the full running. Businesses have been expanding their manufacturing capacities. The textiles needed and expedient materials needed have been provided to these manufacturers to ensure their capacity can be expanded in a timely fashion. With joint efforts, since the 2nd of February, face mask production within the country has been improving day in, day out. By the 11th of February, statistics has shown that domestic face mask manufacturing capacity utilization has reached 94%. In particular, the face masks needed by the frontline medical workers, N95 respiratory masks are being manufactured by 98% of the entire manufacturing capacity. 8 provinces are producing at full capacity. And the medical mask, non-N95 masks, the manufacturing capacity is utilized fully. 10 provinces are now operating beyond the full capacity. In provinces where confirmed cases are over 1,000, provincial N95 face masks have seen major improvement in their production capacity. The daily manufacturing capacity in Hubei province has increased from 45,000 on the 2nd of February to 158,000 on the 11th of February. The daily manufacturing capacity in Guangdong province has increased from 33,000 to 40,000 per day. In Henan, Zhejiang provinces, the daily capacity of manufacturing has increased from 0 on the 2nd of February to 14,000 and 100,000 respectively.
Their efforts have contributed greatly to the epidemic prevention and control in the province. Also, with the overall allocation and arrangement, now the frontline medical professionals can be guaranteed for their medical masks needs. For the next step, we will continue to make efforts in the capacity expansion and the production of the masks. First, we will strengthen the allocation and arrangement, addressing the outstanding issues in the mask production, ensuring the quality of the masks produced. The aim is to have full resumption of the production and exceeded the capacity. The second step is to further expand the production capacity for medical masks, especially the medical N95 masks. The capacity will be further expanded. Thirdly, for the key facilities or equipments and the production components, there should be efforts to ensure the supply of such equipments. And for key provinces and key sectors, we will have various means like the designated allocation to ensure the key needs. At the moment, some mask producers have not resumed their overproduction capacity. So we hope that they can have their capacity fully put into operation. And for companies with available conditions, they can have some technical renovation to begin to produce masks. At the moment, there are some local governments who have worked out relevant policies like taxation, fiscal import, and etc. to support the production of masks. Some of the policies are already implemented, while the others are being implemented or planned. So we hope the relevant companies can make every effort to improve or increase their production. It is hoped that with the joint efforts, we can address the gap between the supply and demand. The next question. The journalist in black on the third row. Thank you. From CCTV. In the previous press conferences, NHC mentioned that there would be the one-on-one approach to support the epidemic control measures in Hubei province. So could you please elaborate on this initiative? And how about the total number of medical professionals now working in Hubei province? Can this number satisfy the needs in Hubei province? Madam Guo, thank you for your question. To treat the patients is one of the top priorities, especially in Wuhan, Hubei province. There are a lot of severe cases in Hubei, and there is a challenging task. So we have pooled the resources and allocate such resources to the front line in order to reduce the infection rate and the fatality rate. First, we make every effort to support Wuhan, Hubei province. more than 20,000 medical professionals composing 180 medical teams have already been dispatched to Hubei, in particular Wuhan. And today, the military medical professionals, 2,600 military medical professionals are arriving at Wuhan. At the moment, there are more than 7,000 medical professionals who mainly used to work in the ICU intensive units to help the Wuhan counterparts or colleagues. Second, we have sent the best medical professionals. As you know, we have sent 3 teams of academicians, including the Zhongnanshan, Li Lanjuan, and Wang Chen academicians teams. They are helping Wuhan, and of course, the other parts of the country to improve the treatment for the severe cases and also make explorations so that the treatment protocols can be improved. Also, we have sent the elite teams from the hospitals directly affiliated to NHC. They are also bringing with them the state-of-the-art equipments and take over the patient wards, especially for those severe cases. Also, we have sent the emergency response medical team to Wuhan, and the shelter hospitals are established in Wuhan to take in more patients. Furthermore, 3 mobile P3 laboratories are sent to Wuhan. The aim is to improve the capacity and efficiency of testing. Indeed, it is fair to say that the whole country has been mobilized to send the best efforts to Wuhan. And of course, apart from Wuhan, 16 prefectures and cities in Hubei have also been supported. So we have the counterpart approach. For example, from provinces like Jiangsu, Shandong, Zhejiang, altogether 19 provinces are engaged in this initiative to help Hubei province, and they will try to help Hubei province and the prefectures to improve the diagnosis and treatment. Within 2 days of the arrangements, the counterpart provinces and the prefectures have already identified the priorities of support and developed relevant plans. So within 2 days, 25 medical teams composing more than 3,500 medical professionals are sent to Hubei province to satisfy the local needs. Also, we request that based on the needs of the target prefectures or cities or counties, apart from sending the teams and the facilities, the counterpart province should have another 50% of the resources and teams getting prepared and be ready for further support. Thank you. Next question. The gentleman on the 3rd row. From People's Daily. My question is, at the moment, there's still a surging demand for medical protective equipments or devices.
Thank you for your question. Medical supplies have seen a surge of demand from across the country, in particular the need for protective garments. We have made holistic allocation arrangements for protective garments and other medical supplies. During the Spring Festival, it was extremely difficult to resume the manufacturing. So imported and inventory protective garments have been playing an important role. And after the Spring Festival, to ensure the supply, we've adopted the following measures. First, we stepped up efforts to expand manufacturing capacity. The improvement in the production capacity is the key and the cornerstone for guaranteeing the medical supplies. MOII has sent working teams to guide major manufacturers to coordinate the manufacturers to solve problems with shortage in funding and the difficulties in transportation. Meanwhile, MOII has been collaborating with NDRC and adopted policies to support manufacturers to upgrade their manufacturing capacity. We've provided facility support and provided needed raw materials to ensure the utmost capacity can be developed. Second, we've been bridging demand and the supply. Based on the conditions of manufacturers, we've facilitated the bridging between the demand and the supply. We've set up scientific allocation of the medical supplies to focus on Hubei province as the epidemic unfolds. We also have some dynamic predictions on the near future need, and then we arrange manufacturing schedule accordingly to ensure the supply can perfectly meet demand and it can be supplied to where it is most needed. And third, we've been looking at the whole process manufacturing data. There are stakeholders like the collectors of the medical resources, and we also have dynamic monitoring of the delivery of these medical supplies, and there is a closed circuit management to ensure the track and the trace of these medical supply delivery to ensure they can be delivered to Wuhan in time, on time, and can be handed to the command center in Hubei so that such medical supplies can be provided to where they are needed exactly. It is almost a wartime stage. There has been hundreds of increase of demand, and the Spring Festival break has added difficulties. So during that break, there were great pressures because of the shortage in protective garments. For the next steps, MOII will facilitate the recovery of business operation, improve the technological upgrading and transformation, to ensure the entire supply chain can run more smoothly, including the supply of raw materials and the full staffing, expand the capacity. Next question, please. Journalist on the fourth row from the right side. Thank you. I'm from Shanghai Wenhui News. I have a question related to treatment. According to latest statistics, across the country, cured patients are around 5,000. How should we interpret the cured cases? What are the features of the cured and discharged cases? Will they be of some reference for our next step protocols of treatment? Thank you for the question. And you are meticulous in identifying the increasing trend of the cured patients. On 11th of February, there were 4,700 discharge the patients. Starting from the 7th of February, each day we saw big increase of around 500 and above of the cured and discharged patients. If such rate can be maintained, like for today, the cured cases are already over 5,000. If such a trend can be maintained, we see a very positive signal exemplifying the efficacy of our prevention and control. We've organized experts to conduct a preliminary study into over 500 cases among the cured patients. 90% of the cured patients of mild symptoms or common symptoms. 10% of the cured patients were having severe cases, critical, grave symptoms. So even for critical cases with treatment, they can be cured. Second, the average length of stay for these cured patients was around 10 days. So we analyzed the treatment method. 92% of the cured patients used antiviral treatment in the early stage or in combination with targeted treatment. Respiratory support and circulation support have also been effective. New technologies have also been used, including leveraging TCMs, and these have helped to improve the outcome of patients. We've been summarizing the features of treatment, the experiences accumulated from the treatment of these cured patients, so that some best practices can be included into the treatment protocol so as to improve the cure rate in the future. Thank you. Next question, please. On the left side, journalist from the 4th row. Thank you. From CNR with CCTV. The epidemic situation is still grim. How can we promote manufacturers to resume their business operations? What are the measures adopted by the Ministry of Information Technology and Industries? DG, Madam Cao will take the question. Thank you for question. Yes, we are at a critical timing. There has been incremental and orderly measures adopted. Among them, the restart and recovery of business operations are also important. On the 2nd of February, the Joint Prevention Control Mechanism has issued an announcement for the guidance on incremental recovery of business. Different departments and ministries have also issued supporting documents. Ministry of Information Technology and Industry has organized telecommunicators on video conference. We've deployed the incremental and orderly recovery of business operations. For the next steps, MOII will follow the deployment from the State Council and the Central Party Committee and will focus on the following 3 points. First, an array of manufacturers will restart businesses. Apart from Hubei province, in other provinces, there should be refined deployment plans for incremental and orderly recovery of manufacturers, in particular the manufacturers of disinfectants and protective units. We've been promoting the recovery of the entire supply chain of the protective garments and face masks. Second, the businesses need to follow the quarantine and prevention control measures. Those who have been trickling back to their work have to report their health status and travel history. Once suspected cases is identified, they have to be quarantined immediately and delivered for further checkup. Daily disinfection, monitoring of temperature, the off-peak commuting, and home offices should be recommended. Third,
strengthen support to the small and the medium-sized enterprises. In recent days, the State Council has already worked out measures to strengthen support, especially financial support to SMEs, and at the same time, guide the SMEs to realize the resumption of operation, and also to ensure the protective supplies are in place, ensuring the health of the workers. Next question. On the front row. I'm from Shenzhen Special Zone newspaper. How about the production capacity for the disinfectants in order to effectively control the epidemics? Will there be a shortage of such products, and in the medium and long term? For the bulk products like this, how to ensure the supply and the production? Madam Cao, thank you for your question. Based on the available statistics, in China there are 563 producers in China. For the sanitizers, they have the annual production capacity of more than 5,000 tons, and the back-to-work rate is close to 80%. For hand sanitizers, there are 83 of them with a daily production capacity of 240 tons, and their back-to-work rate about 50%. For medical disinfectants, the daily production rate is over 900 tons, and the back-to-work rate is about 63%. For these three kinds of producers, they also have inventories. So in the shorter term, they can ensure the supply. However, the producers produce the bulk products, and the supermarkets and the households are having strong demand for small packaged products, so there is some inconsistency. And also the packaging companies are not back to work. So for the small packaged products, the supply is faced with some pressure. For the next step, following the guidance from the central government and the CPC Central Committee, we will urge the packaging companies to resume their operation and the production, and also to have smooth transportation of the products. And also, we will closely monitor the transportation of such products to the epicenter to ensure the adequate supply. Thank you. Next question. On the fifth row, the journalist in white. Thank you. From CNR, we noticed that MIIT has sent special officials to companies, especially the producers. So what are the roles they are playing in the companies or enterprises? Madam Cao can take the question. Thank you for your question. To ensure the supply and the production of the key materials is one of the top priorities for the ministry at the moment. For key supplies like medical protective suits, there's still a huge gap between supply and demand. To ensure the consistent and sound allocation and the supply, and also to cooperate with relevant agencies to ensure the production and the quality. Starting from February, we have initiated this mechanism. Up till now, we have already sent 60 special staff to work on site in those producers. And these officials or government staff are helping the companies to address the outstanding difficulties in production and transportation, as well as the supply of such materials. I want to make a special emphasis that this mechanism is a temporary and emergency response mechanism. Once the epidemic situation eases, we will withdraw such a mechanism. We will have last two questions. The journalist in blue. Thank you. From China Health Magazine. Just now, medical teams, has been mentioned that medical teams are sent to the epicenter. Then how about their local needs? Also, in some localities, hospitals have suspended the outpatients departments. So how are those local medical needs satisfied? It's a very good question. On the one hand, we need to ensure the epidemic prevention and control, but on the other hand, we should continue the daily operation of the healthcare facilities. So for areas with a very challenging epidemic situation, the priority is to treat the patients of NCP or the epidemic, and in particular, the key populations like the elderly, the pregnant, and the young. Also, for patients like the cancer patients, their medical needs should also be satisfied. For areas where the epidemic situation is not so serious, it is required to ensure the smooth operation of the medical facilities. The aim is to ensure that the healthcare system is functioning adequately, and also at the same time, we will not we will continue to ensure the daily operation of the medical facilities. It is fair to say that the online consulting services can play a very important role. It can guide the patients to seek medical advices and reduce the nosocomial infection. Many localities have accumulated success stories like Zhejiang, Shanghai, and Beijing. They have offered online medical consulting services and accumulated experience, best practices in this regard. So while saving the NCP patients, we should also treat the patients as in normal times. The last question. Thank you. From China Family newspaper. For the medical protective supplies, has the shortage affect the work of the medical professionals? Madam Guo, for medical protective supplies or materials, they are really important, as you know, in the daily work of the medical professionals. When our doctors and the nurses are receiving and taking care of the patients, the risk to be exposed to the infections is quite high. So the medical supplies are extremely important as the effective protection of the medical doctors and the nurses cannot happen without the medical protective supplies. Also, at the moment, there's a huge need for such supplies, but the demand is very large, while the supply is very limited.
We've adopted a combination of measures: protective garments, medical face masks, their wearing and taking off requirements have been included into our guidance documents. We've also organized national top-notch experts to guide nosocomial infection prevention efforts. In particular, scientific guidance has been provided to medical workers. And in face of the tight supply of medical resources, we emphasize scientific and reasonable classified usage of medical PPEs. I'd also like to suggest that through the media friends and the general public will know that we should use the face masks to protect ourselves, but the medical face masks and the specialized medical face masks should be saved for the forefront workers. Now, we'd like to ask consultant researcher Zhang Liubo from CDC to give us some scientific knowledge and some know-hows. Before I come here, I've received some online questions. First is for centralized air conditioning. A piece of information to be shared here. The Disease Prevention Control Panel and the Joint Prevention and Control Mechanism has issued a notice on the management of centralized air conditioners in workplaces. You may check online for the more specific information under this notice. There are several key issues to give special attention to. First, before the use of centralized air conditioner, the type and the vents, the health conditions, the cleanness status of the vents should be understood by the employer. Most of the central air conditioner can be used safely. This is the first point I want to make. Second, some centralized air conditioner is on a full air system. When we use such air conditioners, the return air should be turned off and fresh air should be turned on. There are also some loops of tubes in the air conditioner, and this is the most commonly seen type of air conditioner. And for air conditioners like this, our requirement is that the air circulation in different rooms should be independent one from another. So the fresh air plus looped pipelines can be used as long as the air conditioner, the fan coil type of the air conditioner can be used only when the air circulation in different rooms are isolated and independent from others. Some air conditioners have the disinfection facilities, and the disinfection mode can also be turned on. The vents of the inlets and outlets of the filter air should also be cleaned on a weekly basis. If infection or confirmed case or suspected case is identified in this workplace, the central air conditioner must be turned off, disinfected, and evaluated before they can be validated safe for reuse. Second question is that if we have we have breathed the second-hand smoke from a smoker confirmed case, will we be infected? As far as we know, the main transmission pathway is format, contact transmission, droplets, and transmission, respiratory tract transmission. This is the main pathways of transmission. Second-hand smoke does not belong to the scope of droplet transmission. Second, if you have breathed second-hand smoke of a confirmed case smoker, that means you are very close with this patient. Social distancing is highly recommended, so try to distance yourself from the smoker patient because he's also a patient. Third frequently asked question is that a confirmed patient had shopped in a shopping mall. Those who have entered before or after this confirmed case, should people of such be quarantined? Our definition of close contacts are very clear. There are two key messages of close contact. First, very close distance. Second, without effective protection. These two prerequisites define close contact. In a specific survey, epidemiological inspectors will decide if you are a close contact or not. So the field epidemiological inspectors will give their conclusions. The fourth question I've received is that some enterprises, some workplaces, some shopping malls have set up disinfection corridor. Anyone passes through the disinfection corridor will be sprayed with some disinfectants before you are released to go. I think such measures are redundant, and they are not effective in cutting off the transmission. Rather, they are even harmful because the spraying of disinfectants may bring some hidden impacts on the health of those who pass through the corridor. We should avoid the adoption of such a measure. I'd also like to make some additional remark, which is not on the question list I've received, but some journalists asked the questions on disinfection and sterilization. So I want to make it clear that disinfection of the virus and sterilization of bacteria, and this time we focus on virus, which fall into the realm of disinfection of virus. That's why there is mounting concern on alcohol disinfectant. Over the days, I've heard that because of the inappropriate use of alcohol, there has been fire or burning on people. So we should give special attention to the use of alcohol. So I'd like to make some additional remarks on the use of alcohol. According to our current understanding of the coronavirus and people's immune resistance is based on our existing knowledge of the past coronavirus, which have shown surrender to all kinds of disinfectants. And for the novel coronavirus, according to the guidance from the WHO, in our current use, the chlorocycline has shown not as effective as the disinfection on previous coronavirus.
Thirdly, if we use alcohol or ethanol, the best way is to use as the hand sanitizer because it's very fast and effective. But if you use it on other parts of the body, then it should be on limited area. If you use it as an air sprayer and also use it in sweeping the floor, then it is harmful, and that's something that you should not do. That's all. Thank you. Thank you very much, Professor. Now, let me give you some updates. So between 0 to 24, the increased confirmed cases more than 15,000, including more than 13,000 from Hubei province. And for severe cases, there's a reduction of 174. Also, in several provinces, like Guangdong, Guangxi, Hainan, we do have increased new cases. Also, the moderator is reading a lot of figures which are not available to the interpreter. So the interpreter strongly suggests the audience to confirm with the moderator after the press conference. Journalists are kindly invited to confirm with the speaker for the figures which are being read out, but unfortunately not available to the interpreter. In order to ensure the early detection and appropriate treatment of the patients, especially in Hubei province, Following the 5th version of the treatment and diagnosis protocol, the new statistics, the new terms for statistics are improved from previous, are changed from the previous practice, and the key is to further increase the success cure rate. So the previously unconfirmed cases in Hubei province are now calculated into the confirmed cases based on this treatment and diagnosis protocol. So these are some updates. In today's press conference, Madam Guo shared with us information about the medical professionals flying to Hubei to support their colleagues there. At the moment, we have the medical professionals from different parts of the country working together in Hubei. With the masks, we are not able to tell who are they, yet their dedication has really been touching, and they are saving lives, they are protecting people's health, they are fighting against the epidemic, and people's health and lives have always been their priority. We look forward to their successful returning back to home. There's a dedicated column in our platform, and also there's a dedicated song for the medical professionals. Journalists are kindly invited to strengthen your coverage on the adorable medical professionals. Tomorrow we are going to have the press conference, same time, same place, and that's all for today. Thank you very much.